Epidurals, they are one of the most misunderstood things on the internet and in patients' minds. So today I want to talk about some frequently asked questions about epidurals so that you can understand them a little bit more so that you can make the choice when you're in labor if an epidural is right for you or not. Of course, when you're learning about something as important as epidurals, you want to make sure that you're learning from an expert. Hello, I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I've actually had like 5 epidurals, 3 babies, 2 for my tailbone. So I'm an expert on epidurals, not to mention the thousands of patients that I've seen who've gotten an epidural. So I really understand them, and I can help you guys understand them too. Now, during my introduction, you might have been like, make the choice when I'm in labor. Hilary, I already know I do or I do not want an epidural, but I am here to tell you that things may not go according to plan. So I think it's really important to learn some natural pain management. I have lots of videos on that. And I think it's really important to learn about the epidural, even if you're not planning on an epidural, because you don't know what kind of birth you're going to have. Of course, this is why I recommend a high quality birth class. Come join me in the online prenatal class for couples where we prepare you for whatever type of birth you're going to have. We have chapters on induction, C-section, epidural, natural pain management, even communicating with your provider, because that is really how you make the choice for what type of birth you're going to have. I'm excited for you guys to join me in there, but let's talk about some of the most asked questions about the epidural. Okay, question number 1, when can you get the epidural? Now that really depends on your doctor. Nurses actually can't do anything without a doctor's order. So when I started in labor and delivery, a lot of doctors were saying patients can't get the epidural until 4 centimeters because they are the worst. But I've really noticed that most providers anymore are saying patient can get the epidural when they request it. And studies back that up. The best time to get an epidural is when you are wanting it. Now, I always caution patients to not get an epidural because they're afraid the pain is going to come later. I think the best practice is to get the epidural when you think you're ready. Now, I always recommend that you tell your nurse if you're wanting to probably get an epidural, just so that they can kind of gauge how things are happening on the unit. If we can see that a C-section is happening and that's going to delay anesthesia for an hour, a lot of times they can say, hey, if you're wanting an epidural soon, we have a window of time where we can get that epidural before the anesthesiologist goes back into the C-section. So let your nurse know if you think you're getting to around that point so that they can kind of notice the flow of the unit and help you make the best choice for you at the time. Before we keep going, I do have a whole post over on the pregnancy nurse that talks about all of these questions plus links for more information. So if you're looking for more information about the epidural, I'll put that link down below. Okay, next question. Is it ever too late to get an epidural? And this really varies on if it's your first baby or your second baby. Really on your second baby, once you hit about 8 centimeters, we are really getting to a point where an epidural just won't be effective. Most often because those last few centimeters go quicker on subsequent babies, and you usually, not always, don't have to push as long. On your first baby, honestly, you can get an epidural up until the point that you're pushing if you're really uncomfortable and you want it. So while it varies from patient to patient, it's a little less important on your first baby. On your second plus babies, sometimes it is a little bit too late to get the epidural and you just got to muscle through. The good news is once you start to be able to push, a lot of times it feels better because you'll be able to push against the pain, which is different than just simply trying to relax against the pain. Okay, the next question is, how is the epidural put in? And I'm actually not going to answer that here because I have a whole video here that shows how the epidural is put in. I put it into a Raggedy Ann doll so that you could see, using common household items for the most part, how it gets put in. The Cliff Notes version is that you hunch over, they put a needle in your back, and then they drip in medications. But I think you guys will really enjoy that video. I'll link to it here. If for some reason it's not showing up, the name of the video on my channel is how they put in an epidural. Pretty creative, right? Okay, the next question is, what if I'm too numb or what if I didn't feel too much? The good news is the epidural can actually be tailored to you. They do give a bolus when they initially start the epidural, and a bolus meaning a large amount of pain medication. But once we finish that off, it goes in like a drip, just like the IV. So the medication just consistently goes in on your back. Now, if you feel you're too numb, we can turn that drip down. And if you're feeling too much, we can turn that drip up. Of course, if you're feeling too much, it may mean the epidural isn't working and they might need to replace it. A lot of times providers will say you're feeling pressure, not pain. But if you're feeling a lot with the epidural, make sure that they're calling the anesthesiologist into your room. I have worked at facilities where the anesthesiologist was not that willing to come into the room. But if the patient said, I want to see the anesthesiologist, you can bet your bottom dollar I got them in the room because you are paying them hourly for that epidural and you deserve to see them if it's not working. Just a little pro tip for you. Okay, the next question is, does labor still hurt with an epidural? Now, the epidural really is meant to take away about 80% of the pain. You're not looking to be totally numb like a lump on a log. You are looking to still be able to move, feel a little something, especially as the baby is in the birth canal. It helps you push a little bit more, but you're not looking to feel excruciating pain. So you're looking for that 80% mark. Some people just want to be completely numb, and ultimately that isn't helping you out because movement is still going to be important with the epidural, and feeling a little bit of something kind of gives your body some feedback that you're in labor and labor needs to keep progressing. So you're looking for that 80% mark. If you're feeling more than that, again, ask them to speak with the anesthesiologist or the CRNA. A lot of people wonder, how long does the epidural last? Now, your mom may have gotten an epidural back in the day. This happened with my first baby, who was born in the year 2000, where they just put in one big dose of the epidural and then they would come and redose you. So you would get super, super numb, and then it would start to wear off and they would give you another dose. As I mentioned before, now we have the epidural dripping into your body. So it's going to last as long as you need it. Now, of course, the longer you have it, the more likely the tube is to come out of your back or there to be some issue, but they are designed to last as long as labor needs them to last. Okay, what type of side effects could you have from the epidural? I actually have a whole video on weird side effects that you might get from the epidural that you guys might want to check out. But the top 3 are itching, totally annoying, but some people itch when they get the medicine in their body. Sometimes your blood pressure drops, and we work to make that not happen by increasing fluids before you get the epidural, but sometimes blood pressure does drop. Pro tip, you are going to know if the blood pressure is dropping before your nurse knows. And so if you're feeling weird after the epidural, be sure and let your nurse know. And the final one is shaking. A lot of times people get shaking after the epidural. We don't exactly know why, but my pro tip for that one is, if you are shaking, stick your tongue out. Like that. You're just going to stick it out. I don't know why it makes it stop. Maybe your body doesn't want to chew your tongue off. And either way, a lot of times it helps. The other thing is to not fight it. Sometimes if you just let it go and try and get a nap, then a lot of times when you wake up, the shaking is gone. Okay, when do they turn the epidural off? Great question. It usually is after they have repaired, if you need a repair downstairs. Usually the epidural lasts for about an hour after we turn it off, and then we try and get you up to the restroom. It really varies. I had one epidural where one leg was super, super numb for an extremely long time, and sometimes they wear off a little bit earlier for some people, but we do try and get you up about an hour after they've finished making sure that your downtown looks fine, and by then your legs should be working pretty well, although not for everybody. Sometimes it takes 2, sometimes even 3 hours. Okay, if you have an epidural and you need to go back for a C-section, what happens then? Great question. So usually when we go for a C-section, you get something that's called a spinal, which is a little bit different than an epidural, although to you, it would feel exactly the same. However, if you already have an indwelling epidural that is functioning well, they can give you extra medications to just make it work for the C-section. So that's an awesome benefit of having an epidural. Okay, finally, what should you be doing while you have the epidural? Like I said before, you don't want to just be like a lump on the log where you're not moving or don't want to move. I am a huge fan of getting a nap in when you got that epidural, but after that nap is over, I'm a big fan of also turning and moving about every 30 minutes and changing your position. Movement is still super important, even if you have an epidural, and we can still safely do that in the bed using different positions, using different supplies in the room, like a peanut ball, to change how your hips are oriented to hopefully help baby come down into the birth canal safer and more quickly. So try and move as much as you can. Get your partner involved to help move you, because that's really going to encourage your nurse to help you move more frequently as well. Oh, one I forgot is that, do you have long-term back pain from the epidural? Now, I hear this all the time on social media, but when you look at the studies for people who went natural versus those who got the epidural, there was actually no increase in long-term back pain between the two people. We just have to remember that pregnancy is hard on our backs. Having a newborn is hard on our backs. Let's talk about carrying that car seat, bending over to put them in the crib, or these weird positions that we get in to feed our babies. So make sure that you're taking care of your back. And if you're having back pain beyond the initial bruising period, which you'll also get with just the IV, you want to be sure that you're maybe seeing a physical therapist to see what you can do to change your body mechanics with a newborn, do stretches to promote the health of your back. So epidurals have not been proven to cause long-term back pain. There can always be complications, and prior to the epidural, your anesthesiologist will do an informed consent with you about what to expect with the epidural and what things could be a complication. Okay, those are some of the more frequently asked questions. Did you have questions that I didn't answer? Tell me down in the comments. Maybe I'll make another video about frequently asked questions about the epidural. And of course, if you guys like this video, please give it a thumbs up and follow me so we can hang out for the rest of your pregnancy. Now, I have more videos on pain management during labor labor, I hope you'll come join me in there. But if you really want the full skinny, come join me in the online prenatal class for couples, where we have both a natural pain management video and a whole section on pain management options, which includes IV, nitrous, more stuff like that. So come join me.